Our group has chosen to address the problem of a lack of health education among community members and during outbreaks in developing countries. Our solution is to design a cell phone app that would provide helpful public health announcements and education. This would include how to watch for signs of certain diseases, how to treat certain illnesses, how these illnesses spread, when to see a doctor, and what to do and where to go during an emergency. In Haiti, a country that has suffered several natural disasters and epidemic outbreaks, public health is essential to improve the health and well-being of the people. However, creating a functioning public health system in Haiti is difficult due to a lack of leadership and funding. This problem makes it difficult to understand and control illnesses and diseases in communities, especially during periods of outbreak. The problem we will address is the breakdown of public health communication to control illness and during outbreaks. We believe that our cell phone app will be a great solution to this problem, especially as most of the people in Haiti have access to a cell phone if they don't have one themselves, whereas very few people have access to a computer or internet connection through a computer or even a television. So making public health announcements through those mediums is less effective. This is also a very affordable approach to informing the people, educating them of public health issues, and also informing them when there is an emergency. So this solution is cost effective and efficient in reaching out to the people of Haiti.
In order to gain a better understanding of this public health problem in Haiti, we were able to gather information from the CDC, also the World Health Organization, just to gain an understanding of where the public health system is and how the public health system is currently operating in Haiti, and some of the problems that might exist, or some of the challenges that the public health system faces in treating the people of Haiti. I was also able to take a personal trip to Haiti last month and assess several communities as far as their public health needs. I was able to do this by just conducting simple interviews with community members, asking them how the public health functions in their community, what things they think could be improved upon, and things that would help them to have a better understanding of and aid in their own personal health. And a lot of the ideas were simply educational ideas, understanding the diseases and how to prevent them, how to treat them, how to stay healthy, when to go to the doctor. A lot of people can't afford to go get a regular checkup, but they definitely want to go to the doctor if they need to. And so understanding some of those issues would be helpful to them. We would go about implementing our intervention by seeking an audience with the Haitian Ministry of Public Health and Population, and that's the current working body of public health in Haiti. So an app that they were able to support and supply and give to the entire country of Haiti, and making that something that came from the top down, I think would be very respected in the country, something that all of the people would be able to use easily on their cell phones, and something that they would be able to trust because that's coming from their public health governance. So we would begin seeking an audience there and supplying this idea and proposing it as a way to educate the people. Additionally, as we work on this intervention, it's important to remember that a lot of the people are illiterate or have very little education. So making the app really user-friendly in a way that either has, the application is verbal and pictorial in order to help the people understand in a very friendly and simple format the different illnesses and diseases that might be a challenge for them, and providing that important information of how to treat it and where to go if something like that is to occur. As an overview of our intervention, now that we have kind of explained why it would be important and how we would implement it and how it's going to help solve problems in Haiti, we're just going to share a few bits of information that we've gathered that we would supply on our application. So these are the prevalent diseases that might be in Haiti and also an idea of how the alert would work. And this is just information that we would make available to people. We will continue working on making it really user-friendly and understandable to the people of Haiti. And here we have simply gathered information that we'll begin submitting into our application for cell phone use.
When it comes to food preparation, always wash your hands with warm water and soap for 20 seconds before handling food. Keep raw meat, poultry, fish, and their juices away from other food, and do not use the same knife or cutting boards for other meats until washing with warm soap and water. Marinate meat and poultry in a covered dish in the refrigerator. Cutting boards, utensils, and countertops should be sanitized using a solution of 1 teaspoon for storing leftovers. Discard any food left out at room temperature for more than 2 hours. Place food into a shallow container and immediately put into the refrigerator or freezer for rapid cooling. Use cooked leftovers within 4 days and reheat leftovers to 165 degrees Fahrenheit.
Hi, I'm here to talk about diabetes. Diabetes is a metabolic disease in which the blood's inability to produce enough insulin causes elevated levels of glucose in the blood. This is a condition in which the body does not properly process food for energy. Most of the food we eat is turned into glucose or sugar for our bodies to use to have energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. When you have diabetes, your body either doesn't make enough insulin or it can't use the insulin well as it should. This causes sugar to build up in our blood, and this is why many people refer to diabetes as sugar. There's 2 types of diabetes. There's type 1 and type 2. I just explained to you type 1. Type 2 diabetes is, unlike type 1, the bodies of people with type 2 have the inability to make insulin, or its sensitivity to insulin does not make enough to the body, cannot use the insulin well enough. This is called insulin resistance, and there isn't enough insulin, or insulin is not used as it should be. Glucose can't get into the body cells. And when glucose builds up in the blood, instead of going into the cells, the body's cells are not able to function properly. Some of the signs and symptoms of type 1 and type 2 diabetes are frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling or numbness in hands and feet. You're really tired all the time. You get dry skin and sores are usually slow to heal. You can also get nausea, vomiting, stomach pains, things like that. Some prevention you can do to prevent type 1 or type 2 diabetes is type 1 is usually genetic and not able to be cured, but type 2 treatment usually typically includes diet control, exercise, hormone blood glucose testing, in some cases oral medication.
Studies have shown that regular physical activity can significantly reduce your risk of developing type 2 diabetes. Type 2 diabetes is also associated with obesity. You should see a doctor as soon as you see signs or symptoms. Contact your doctor, and the earlier the condition is diagnosed, the sooner treatment can begin. Diabetes is a serious condition, but with your active participation and support in your healthcare team, you can manage diabetes and enjoy a active and healthy.
To provide an example of an emergency alert that would occur on our cell phone app, our group has chosen a cholera alert. This is an outbreak that has happened in recent history in Haiti, and the alert would flash onto the phone much like an Amber Alert appears on cell phones here in the United States. So the alert would automatically sound, informing the people that something important is going on. It would give the people the name of the problem and draw their attention to the fact that there is an emergency public health announcement. It would then proceed to give the symptoms of the disease. So in this case, in the case of cholera, it would flash the symptoms of watery diarrhea and dehydration. In severe cases, it would ask them to look for sunken eyes, cold skin, decreased skin elasticity, and wrinkling of hands and feet. The skin can also turn bluish. Muscle cramping and vomiting clear liquid may also occur. The app would prompt them to seek medical attention and oral rehydration salts, and also inform them that death can occur within hours of symptoms if left untreated. It would then flash information on how the disease is spread or transmitted. So in the case of cholera, it would inform them that the disease is spread through food or water contaminated with human feces containing the bacteria. Insufficiently cooking seafood is a common source, especially in Haiti. And it would then help them to understand how to best prevent spread, and that would be by sanitizing hands and clothes that have come in contact with the cholera patient. Secondly, of course, it would help them understand how to avoid contaminated food or water and direct them on how to clean or filter their water. Informing them that all water used for drinking, washing, or cooking should be sanitized either by boiling, chlorinization, ozone water treatment, ultraviolet light sterilization, or antimicrobial filtration in any of the areas where cholera may be present.